Hey everybody, and welcome back to Human Nature. I'm Jamie Clements.
I'm Louis Blake.
And this week we are joined by the good doctor, our doctor, Dr. E.
Our doctor.
Founder of HUM2N. Doc, thank you so much for joining us, my man. How are you?
I'm really well. Thank you for having me here.
It's good to have you here. And we've just been chatting about everything that we are planning to dive into. But before we kind of dive in at the deep end, can you tell people who aren't familiar with HUM2N and what you do, everything that you do?
Yeah, so I'm a doctor. I've been a doctor for 15 years. I'm qualified GP in the UK, so I still work in the NHS as a GP. And about 10 years ago, I started to look into the science and medicine of living longer and understanding how to help my patients with alternative approaches and what was coming out at the leading edge of science across regenerative medicine. So that's stem cell medicine, ultimately how the human body regenerates naturally or slows down to regenerate itself heal naturally. Functional medicine, which is how the systems of the body are designed to function and how we can support them to function better. And I have a background in aesthetic medicine. So my previous business to HUM2N was a kind of medical spa where we were applying those principles to the signs of external aging. I founded HUM2N during COVID, just because I wanted a really health-focused brand. And it's got the 2 in it. People always ask me, they don't know, we don't communicate it well enough, but the HUM2N with the number 2 in it is about helping people to be their 2.0 with their software upgrade, just how we have our softwares with our phones. And we do that through deep testing, identifying imbalances, taking people through a health journey, prescribing them nutrition, lifestyle strategies, plus supplementation. We've introduced peptide therapy, bioidentical hormones, and medication. And in the physical side, we have a suite of tools, things like hyperbaric oxygen therapy, ozone, cryo, muscle building devices, etc., that we personalize and prescribe to patients to help them feel the best they can wherever they are on their journey in their health state. So at one end, people that are healthy, athletes, high performers, people like yourselves, and at the other end, people that are in complicated health states, be it Parkinson's, Alzheimer's, autoimmune crisis, cancer. And so as a doctor, it's a real privilege to be able to work across that breadth of humans and support them to ultimately improve their quality of life.
I want to pull out a couple of the words that you mentioned just now because they're very topical in what we hear on podcasts, what we hear in the media at the moment. One of them was peptides. It's a journey that I've been on recently. But for those that don't know what peptides are, can you give us a brief or as detailed as you'd like description as to what peptides are and how they can benefit us?
So peptides are ultimately short chain proteins. So they're a molecular structure of a type of molecule. And over the last 10 years, they've been studied as a way of delivering a health intervention. In fact, the most famous peptide is something called insulin. So it's something that we give to diabetic patients or type 1 diabetic patients where their pancreas stops making insulin. But more recently, the second most famous, or currently the most famous that people are talking about, are GLP-1s or Ozempic or Manjaro. That's a peptide, glucagon-like peptide 1. So peptides are a form of a molecule structure. They are different to drugs in the sense that they don't directly do the work. They are bioregulators, so they regulate your own biology to do the work. I describe them a bit like thermostats or switches, where it's not the switch that puts on the light, it's actually the electricity that puts the light on, but it regulates the electricity. Yeah, so the peptides, we're known to, science has established there's probably 200,000 plus peptides that are known currently that float around the human body and do different things. And so out of those, the ones that have been more widely used by doctors like myself around the world are probably about 15 peptides more, that have a strong evidence base behind them. What I like about peptides is they're generally quite safe, right? In the right person at the right time. And they can counteract the symptoms of aging or the symptoms of overexposure to a stressful environment. We were talking outside about allostatic load, and as you're saying, Lou, correctly, like we're at a time where there's more allostatic load than ever before with basically how much we're exposed to and the environmental stresses on us. And so that dysregulates our biology. And so we can now prescribe peptides to upregulate certain biological processes and pathways to work better. That could be for disease state, or it can be for performance, depending on where you're at in your health. So some common peptides that we're using in practice, so you've got the ones that help with weight loss and appetite. So that's the GLP-1s.
Mm-hmm.
Then you've got ones that support growth hormone release. You remember, I don't know if you remember back in the day going to the gym and you'd go to, everyone would be talking about either steroids or growth hormone, right? And now there's, I think peptides an evolution to say that actually you can take growth hormone releasing hormone peptides, which are much safer, that won't stop your own production of growth hormone, that won't give you are less likely to give you the major side effects of overdosing on growth hormone, and such as insulin resistance or carpal tunnel syndrome.
Mm-hmm.
So generally quite safer. So that's another common one that's being used.
CJC, ipamorelin?
Yeah, exactly. Yeah. CJC, ipamorelin, tesmorelin, sermorelin, these are all different forms of that molecular structure that stimulate growth hormone production. Alongside that, in the musculoskeletal world, you've got things called like body protection compound 157, BPC 157. That's been used in bodybuilding for a long time, and also been used for helping people that use their physical body a lot, have likelihood or propensity to sprain, to injure themselves, because it helps with building out the extracellular matrix. That's the soft tissue structure that holds our structure together and helps repair quicker. And we've used it a lot in clinic with great results. And another one we use alongside that as a triple stack is something called thymosin beta 4 or TB500. And that's quite nice because it has a dual effect. It regulates the immune system slightly, and it also supports in wound healing and repair. So what does that mean for people that use it, that triple stack? That means that they get more from their workouts. They can work out harder. They can recover faster. They're less likely to injure themselves. And they can increase lean muscle mass, reduce fat, improve their sleep with that triple stack. So I like using that with my patients that are training hard and putting their body through a lot.
Yeah. I felt that with the BP157, the CJC stack, especially with the ultra endurance events, that my recovery from training is much faster. I don't have the same level of soreness. And I mean, touch wood, I've not been injured for a long time, but when I do, I've not had any injury despite the increase in training load. So it's definitely something that I felt the effects of personally. A lot of this information I think can be quite overwhelming for people. I think
Absolutely.
I don't know really where to start. So for someone that would come to you and say, someone that comes to you and says, do you know what, doc, like I'm not really taking care of my health. I'm a little bit stressed. I'm not eating great. I'm not training great. My sleep isn't perfect. I've got low energy. Where would you start with someone to take them through this process? And then maybe we can start about people that are already high performers and how they can rev the engine, as you like to say.
Yeah, absolutely. And I think, look, the starting point is something that we have been working on for a long time. When I started doing this medicine 10 years ago, gathering lots of different types of data points, understanding what tests to do when, what's most important, what intervention to do when, what supplements to do when, what's going to rebuild someone, and then personalizing it to the set of problems in front of us. And that's what we've kind of worked hard to perfect, for want of a better word, to make very good at HUM2N. And that's a set of testing that we essentially make mandatory for our patients. We call it our foundational panel of tests. It looks at about 100 blood and urine markers that represent your digestive tract, a good understanding of your set of hormones across your hypothalamic, pituitary, adrenal, thyroid, sex hormone axis. So your adrenals, your thyroid, sex hormones, your immune system, your inflammation status, your micronutrient status, such as important micronutrients, magnesium, folate, folic acid, activated B12, vitamin D, and then also methylation status markers with looking at homocysteine. Your lipidology and what we call your cardiometabolic, so looking at how you are storing your energy within your body. Are you storing it as unhealthy fat or healthy fat? And what's your engine internally like for that? And is that likely? Do you have a genetic propensity to that could manifest in a higher risk of cardiovascular disease, Alzheimer's, dementia, vascular dementia than others? And this is all of the nuances that we look for in that one panel. Alongside, do you have leaky gut? Do you have yeast overgrowth or major dysbiosis? And that system, as a step one for us, has allowed us to create personalized strategies for patients that gives them a short term and a medium and a long term view on their health. Then we start to help them through nutrition supplement strategies that we iterate, that we evolve over time, because you shouldn't be on the same supplements forever. Supplements are support, and you should be supporting certain systems from experience for periods of time. Yes, you might need to be on certain supplements for longer term, depending on your genetics or your current state. But what we found is that you shouldn't really be on the same supplements forever at all. It doesn't work well. So those are the key systems that we want to look at. And we do the functional, what I call the functional medicine first.
Mm-hmm.
Good functional medicine creates the systems to allow, supports your systems to function better, create balance. Then we go to revving the engine. And that's usually when thereafter the peptides are most effective. I don't like revving the engine with performance peptides before there's good balance internally, because you're masking your symptoms. And so that's our kind of methodology. And then thereafter, longevity, right? Then it's the long-term stuff, thinking about other forms of peptides, like epitalon or MOTC or SS31 that we personalize to patients outside of just physical performance, how we can stimulate stem cell production, how we can protect the brain and stop developing amyloid plaque, which we accumulate over time associated with dementia, with peptides like cerebrolysin, for example. And so what's really nice is that we understand supplements and their role. We've been working with them for a long time. We understand peptides, we understand bioidentical hormones, we understand medication, we understand therapies that have a role. And because we understand all those tools and we're equipped to work across, as doctors, traditional doctors, GPs that are trained in that system, we also understand disease, more complicated disease. So it allows us and enables us to really personalize people and support them as we rebuild them over time. And they're just continually improving. That's the philosophy, and that's the strategy.
It's the future, right? It's like this preventative, highly personalized approach to medicine. Where is modern medicine going wrong, and how do we bridge that gap? Because I also think that, at this time, this is accessible to a select number of people, right? It's great. Both Jamie and I have been through the program and benefited hugely from it. But then I look at the other end of the spectrum and, traditional NHS care. Mostly it's management of symptoms, right? Sure. And then there's not the interventions to help people make changes in their lifestyle. So how do you see that we can get to scale this approach out? What needs to change to make it accessible to more people?
Our attitude. That's the biggest thing that needs to change. And I say I mean health professionals' attitudes. The education system that is training and churning out the supply chain of future doctors and allied health professionals. What within the attitude needs to change? We need to understand and appreciate that disease starts at health. It starts when you're healthy. Your healthcare shouldn't start when you're sick. It should start when you're healthy, as simple as that. And that's a philosophical shift. Now, we think about how that manifests in how we educate then. When I did, when I did my TEDx talk years back, 2019, I did it. And I had to really think about this, because as part of that, they ask you to really think about where things come from. And for me, it was this very definition of health. As simple as that. Textbook definition is the absence of disease. It should be the absolute state of vitality the human body can produce. Because it's a set of systems and processes, right? And then if we start with that definition and we seek to achieve that, then our research institutes will start to want to achieve that. Funding will follow. Our education system will start to add that to the curriculum. And education system, then supply chain follows, the doctors, the experts, and the adoption of that methodology of care. Now, that's actually a big ask. to ask the medical system that has been created over time to produce excellent interventions for disease, complicated disease, cancer therapeutics, complicated cardiovascular disease. This is why, to some degree, patients are living longer with chronic diseases, although we've hit a curve, a plateau on that, and actually a downturn. So it's a big ask for the whole system, which is industrialized the human body. What do I mean by that? Like Ford industrialized the production and the manufacturing of the car into an assembly plant process. Yeah, you had headlights made here, you had exhaust made here, you had windows made there. They bring them all together and they put them on an assembly plant. The same thing has happened to the human body. But instead of parts, it's organs. You have a lung specialist, you have a heart specialist, you have a stomach specialist, you have a knee specialist. And in that process of educating our supply chain in that way to be specialists, I go to a lung specialist, I talk to him about my stomach issues, he's like, sorry, I don't know, that's not my area of expertise. So whose area is it? Okay, go to the stomach specialist. And so we've lost the true internal medicine doctor that is looking to keep you healthy, because the GP is not even equipped to do that. Unfortunately, we have good knowledge of how to navigate certain chronic diseases according to guidelines that we're trained in, which are all medication based or referring to specialists. So this is where it requires a big system overhaul. It's possible. And, I work in the NHS. I can see this problem not getting any better, by the way, because when we're reactive, we're just putting out fires and we're not actually getting rid of the burning emblems at the bottom of the fire. We're just, putting it out, starving of oxygen for a little while, but it goes to other parts of the body. We start on one medication, we end up on 20. And the quality of life from the onset of one chronic disease just deteriorates and deteriorates and deteriorates. And that last 10 years of life for most people is a really poor quality of life for the vast majority. And so we have a lot of work to do. But I also understand that it's challenging being a doctor within that system because you are just 10-minute appointments non-stop with fires that need to be put out temporarily. So even in that model of care, I struggle with the knowledge and experience I have to apply that in 10 minutes structure as in good primary community care. It's very, very difficult. So you end up going back even with that knowledge. Yes, you talk a bit about nutrition and I'll give a prescription on paper every now and again on exercise and lifestyle and stuff. Yeah. And I'll do that. I'll definitely do it. But it starts with an attitude shift, and we need to put the mirror in front of ourselves as a health practitioner and start to say, do I have all the answers to my patient's problems? Am I asking why you have this disease? And am I seeking to prevent that disease progressing and also get to the root cause of it? Because we're not asking why enough. Yeah. Or how did you get high blood pressure? How did you get this autoimmune psoriasis or eczema or asthma or the common things? Why have you got cancer? Why are these things developing? Because if we answer that, and functional medicine is good at that, then we can start to look earlier for those problems.
Yeah, absolutely. And for, I think a lot here about the public health system and GPs and people in this position where actually they're bound by these 10-minute appointments and putting out fires. What do you think are the real core issues as to why those questions aren't being asked? You mentioned education, you mentioned kind of the system itself. What's the way around it? How do we move beyond that to a place where actually we are looking at root cause rather than simply symptoms?
Think about who's paying for healthcare, right? It's our tax. So until taxpayers, either taxpayers or tax spenders, i.e. the government, start to make this a priority and say, actually, we don't want to be spending our money purely on putting out fires. We need to properly look at the science and medicine of preventing fires. Because we're at a point in time where technology and science is producing all this amazing, more simpler, safer interventions, supplements, peptides, hyperbaric, IVs, NAD. But we're spending at the same time so much money. They're constantly putting out fires. So I think a health economic study needs to be done across a preventative approach or personalized approach versus a reactive approach. That's one element. I think there's three major things that we need to do responsibly as providers of care in a personalized way. One, we need to build data and evidence. Two, we need to build systems to be able to reproduce these client journeys and patient journeys. And three, we need the education system. We need to build internal education systems to educate the supply chain of experts to do it. And I think we're at a good point in time. So those are three things that we need to do. But one of the big challenges that we need to overcome is the fact that because the way we adopt innovations, so things that are innovating in health and science, we adopt them based off a linear methodology, okay? So it's like binary, 0 or 1, and it's related to certain diseases only, right? So it'll be, you have a disease, Loui has, so you have a disease, you do a case control, randomized control trial. Person A has a disease, person B doesn't have a disease. You randomize it and you give them drug A and you give them placebo. And it's based off one intervention, right? Not multiple interventions. So as soon as you say multiple interventions, which is 4 or 5 supplements, nutrition strategy, their brain, the medical system is like, no, we can't do this because there's too many interventions going on. We can't know which one is, and that's where it falls apart. So the whole way we look at how we adopt innovations into the healthcare has to change, especially for the preventative model, because diseases aren't single pathway dependent. There's multiple interrelated systems that contribute to the vast majority of disease progression.
And a lot of it's stuff we can't see, right? There's a lot of talk at the moment around toxic burden, right? Our environments that we're living in, that we're spending time in, are not supportive of long-term health. We're more disconnected from other people than ever, more disconnected from nature. We're living very often in toxic soups, from clothing to cleaning materials in the home, to where we're spending time in air-conditioned offices. I think this move away from nature and the natural world is causing a lot of issues. Beyond that, we are more stressed than ever, right? In terms of what we were talking before the podcast today about how the fluctuation in stresses, they're just day to day through, whether it's being on the phone or sitting in traffic. These are all things that have grown hugely over the last few years. What's your view on how somebody that has to function in the modern world, right? We live in cities, we go to work, we're on social media, we're spending time on technology. How does somebody function in the modern world whilst mitigating the negative outcomes from being in what is effectively a toxic soup on a daily basis?
Yeah, I think it's understanding. I think what we don't do very well is understand that we're a biological organism that is dependent, and our biology changes according to our environment, which is exactly what you're talking about, right? An environment includes everything that we bathe this body in, from lighting, clothing, food, digital, etc. So we have to understand, firstly, what I found very useful in my own personal health journey is understanding when I am feeling really good, what that feels like, being in my body, being present, what that feels like. And and then bookmarking that, okay? It could be after a nice, peaceful, relaxing weekend in nature or abroad, like really switching off from the environment, be eating clean, etc. Bookmarking that, and then using that as a reference point in relation to day to day. If you can add data points to it, fantastic. Like a wearable can come in really handy. And I utilize 2 main markers: heart rate variability as my sign for what I call resilience, biological resilience, basically, and my deep sleep. Okay, those are my 2 markers that I can correlate to how I'm feeling if I'm feeling a bit more on edge, if I'm more irritable, if I'm not sleeping as well, if you know, if I'm just feeling more fatigued, etc., etc., then I can work backwards and start to say, okay, what's changed in my environment? Then you need to start practicing. You need to start trialing different things. Screen time. Look at your screen time. Switch off your phone for a little while. See if that makes a difference. Trial different types of food. Go dairy-free. See if that makes a difference. Try and remove other types of toxins. Change your sleep environment. These are all the things that you can start to understand how your body reacts to those different environmental things. And as you do that, you get to build up your repertoire of knowledge of how your human body reacts to the environment you're in. And then with that knowledge, you get to like curate the things that work for you so that you can try and get to feeling better a lot more of the time.
How do you feel, what role does trauma play on the manifestation of disease? Because in Western medicine, we look at things as in a very literal sense, right? You have cancer because this.
Yeah.
A more Eastern approach is a more holistic view on how, let's say, suppression of your voice when you're a child may manifest as throat cancer, for example. What's your view on unresolved feelings and how that manifests in disease in the physical form?
I think there's, undoubtedly, there's a link that's very well established that everyone understands within healthcare, that stress kills. Stress drives disease. We understand more and more now that traumatic events that we find as traumatic, whether it's conscious or subconscious, lead to a sequelae of biological responses that generally are pro-disease progression. Interestingly, also, that kind of Eastern medicine, we call it Eastern medicine-based approach, which is the flow of chi or energy through your energy centers. Trapped energy in different centers can manifest in localized disease in different centers is fascinating. I don't think Western and Eastern medicine has got there enough to explain that fully with data, but that's there and present, and I believe it. I believe in it. Then you've got like what's known as TIB points within the body. The acupressure, acupuncture points, mapping different parts of the body, which is also a form of Eastern knowledge, actually. That's used in cupping. It's used in acupuncture, which has been shown to be very helpful for many diseases as well. So I think there's some way to go in being able to marry the two, utilizing data with actionable prescriptions off the back of it. However, resolving trauma is so important, isn't it? Is understanding how what the traumatic event was, and then how you're responding to it, and how that trauma in the past is manifesting for you in your day-to-day thoughts, behaviors, and actions and reactions. And that's the kind of, I suppose, inner work that's so important to do as part of someone's healing journey. Because in patients I've worked with where they're not really understanding that part of themselves, you can take as many supplements as you want and do the therapies, but if you get triggered into a stress response and a pro-disease response through, someone looking at you the wrong way because of previous trauma, then you're just constantly adding these stresses in, and you're not going to heal as well. Healing requires a calm, parasympathetic tone state, deep sleep, relaxed state. And the body shuts us down when we're sick to give us that state, right? Like when we've got the flu, what happens? We've got no energy, we need to sleep. And we're having really good deep sleep, right? When we're sick. But it forces it on us, and that's when the energy is used to heal. But if our energy is going elsewhere, driving a nervous response, being on edge, we're not going to have the capacity to heal.
Yeah, I think that's something that I think about a lot, relating to, whether it's longevity medicine, biohacking, these therapies that we've been talking about is, and this is what I love about your approach, where it is very much the functional, the holistic, the lifestyle piece alongside, almost to lay the foundation for those things. Because something that I feel we see more of as this stuff comes into the mainstream is people skipping the basics, skipping the foundations and going, I'm not going to think about nervous system or psychological health. I'm not going to think about lifestyle really at all. And I'm going to just sit in a hyperbaric and have an IV and expect to feel better. Is that something that you see as well, is almost people wanting the quick fix, and maybe they can afford it, or maybe it's accessible to them financially or just by virtue of their lifestyle?
You know, I think we used to see that more when we first started offering these services, when it was less understood. Over the last kind of 18 months, 2 years, our patients come to us for the strategy and the support and the guidance over time. So we're seeing that less, and we're definitely not that clinic to go to just book yourself in for a hangover IV and, you know, I'll jump in the hyperbaric just for a one-off experience and feel a bit of energy. I think, we're definitely more at the medical end, which is how do we get you long-term sustainable results? You're absolutely right. You know, I call these therapies, they're all just support. They're jetpacks that support for a period of time certain processes to work better. But if you're not making the right decisions and educated and informed to make the decision when you're outside of the clinic, then you're just going to be getting yourself back into that spot. So it's your education around your nutrition, around your sleep, around your relationships, that we slowly help people to understand, because everyone starts at a different point, and that's why it's nice to see patients over a period of time.
Let's talk about a few of these though, because there's a lot of buzzwords around that I don't think people understand. So NAD plus, we hear about NAD plus a lot at the moment. I first discovered it through you. I found it really helpful. What is NAD plus? Why might someone supplement or get an IV with NAD plus?
So the science behind NAD plus came out, probably about 10 years ago, started to really come out as part of longevity science, which was establishing these hallmarks of aging. So processes which basically describe a set of processes that slow down or works less efficiently as we age, that are correlated to aging. And one of those hallmarks was a loss of NAD plus within the cells as we age. So by the time we're 40, we have 50% less in a population study on average compared to 20. It gets used up by stress, inflammation, and aging predominantly. Now, what does NAD plus do? NAD plus is a vitamin B3 specific derivative, nicotinamide and a dinucleotide, bit of a tongue twister, and it's used in the cells to make energy, one function. So that's in the mitochondria of the cells. So, and we'll come back to oxygenation being so important for thriving and survival. Oxygen is the most important nutrient, right? And okay, so we'll come back to that. So it helps create cellular energy. Secondly, it was found out to be a precursor for dopamine. So it helps with people that are dopamine depleted, be it from substance misuse, be it from anything that depletes your dopamine too much. And then if you're doing NAD plus, it helps with your motivation. If your dopamine's up, your motivation, your get up and go is slightly better. And then third, it helps with these longevity processes and pathways that are involved that go on behind the scenes, which is helping your DNA repair, helping in some of these the misfolded proteins, clear that up at a cellular level, and which directly drive inflammation, which accelerates aging. So I like NAD plus for my patients in the IV or subcutaneous form. It gives more of a feeling. You get more of the first two, so more energy, you get more of a motivation, and indirectly more sleep benefits as well. You can take oral precursors like NMN or NR. That works on what I would say the third pathway, which is the longevity stuff. When you take it, you don't notice. I don't know if you guys have tried the NMN precursors. You don't really get as much as kind of like the get up and go and performance benefits as you would with the NAD. And so where we're trying to move people's health forwards, we started to deploy NAD plus in practice for the principal benefit of mitochondrial support in long COVID. And that's when I started to introduce it to patients that were profoundly fatigued, had mitochondrial dysfunction. I don't know if you knew anyone. We all heard stories of people like just out of after getting COVID couldn't get out of bed. Yeah, and we were seeing those sorts of patients and helping rebuild them. One of the tools we were using was NAD+. And I was like, okay, this is when I became a big believer in NAD+, in its potential, and also understanding of the big function of the mitochondria in disease pathology as well.
I believe that's one of the challenges with any of these long-term interventions, is that most of us are wired to heavily prioritize short-term over long-term. And that inability to think longer term is very often what puts people in a state of poor health. It's difficult to think long-term and I'll just have that one thing. It makes it very, very challenging. One of the things that has, I believe, benefited us in respect of that is biological age testing. So being able to get a view on, okay, what's our biological age versus our chronological age. I'm a little bit frustrated about this, though. I'll share some of my most recent results because there's some discrepancy and I want your view on this as to maybe what I'm doing wrong, or better for me if the tests are actually wrong. So I did a test. One test I did with glycan age showed that my biological age is 40. My chronological age is 35. So you're not very happy about that one. I did a bioresonance test. I've done 2 of those now. I actually managed to reduce my age on my bioresonance test down by 6 years from when I was first tested to 32, 31 on that one, I think. And then when I did my my biological age test from a VO2 max, I think it was 24 or 22. So vastly different results. Why am I getting different results? And am I actually 40? Because that wouldn't be great.
You don't look it, mate. You don't look.
Thanks. That's all. I'll come on to skin in a minute.
We'll go on to aesthetics in a minute. Yeah. All the surgeries.
Yeah. So I mean, biological age. There's no one test that looks at the whole human body that says, okay, this is your biological age. Biological aging in your different components of the body happens in different rates. So let's talk about those 3 results that you had. So let's start with the glycan age. So glycan age is a good test, but it particularly focuses around the rate of aging associated with inflammation. Okay, and inflammation can be typically for you would be caused because I know your diet and I know your lifestyle to some degree as your doctor. If you've been honest with me, is related to training for you. Yeah, you train 5-6 times a week. You're doing ultra endurance events. You're putting your body through, we'll all agree, an unusual, abnormal, excessive amount that it's not designed for, right? And that's going to generate inflammation and not give you enough time to recover between those sessions. And that's why the peptides have been quite helpful for you to some degree. And I see that a lot with the athletes. Their glycan age tends to be higher. Other reasons why glycan age can be higher is other sources of inflammation. It could be glycemic control, so high circulating insulin or high blood glucose. It could be coming from your leaky gut driving an autoimmune response, causing joint swellings or brain fog or psoriasis or eczema or hay fever. So those are things that drive glycan age to go up. Okay, so let's talk about a second test, which was your bioresonance. I believe bioresonance looks at biological age from a visceral fat composition perspective. Bioresonance is basically the conduction of electricity through a water-filled body and to see how it conducts from one side to the other. In doing so, it establishes muscle content, fat content, hydration status. And so it's looking at kind of from a metabolic perspective. It's the least accurate of the 3 that you've described, but it's younger than, it's 30 compared to 35, and you're metabolically very healthy. Yeah, you don't have high visceral fat, you don't have high body fat, subcutaneous fat as well. So that makes sense. My favorite one of the 3, which I think is the most important one actually, is your VO2 max, because that's the closest to representing how your body will function. Okay, and that deteriorates more rapidly with less body function. And what does it represent? Your cardiorespiratory system's ability to take oxygen and make energy, right? So when you do the VO2 max test, either on a treadmill or on a bike, they take you through stepwise progression to the point of point of failure. And what they're establishing is how long you can utilize energy for, oxygen as an energy source, and glycolysis, which is drawing on your glycogen and your sources of carbohydrates as an energy source before you go into anaerobic, and how long you can stay in anaerobic respiration as well, and drawing on your fat stores as well as in your energy stores. The production in your body's capacity to create energy is how you function, right? So that's for me is the most important, and you hear a lot of talk now about VO2 max, rightly so. And so I think that's the most important one of the three for you to kind of celebrate.
Thank you. How can someone improve it though? Because we're establishing that it's the most important indicator.
Yeah.
Longevity.
How did you improve it? So I'll tell you why you've got a younger biological age. It's low intensity steady state exercises, right? Doing 45 minutes of being in your zone 2, right, which is usually brisk walking or light jogging. Doing that a couple of times a week, where you're doing these ultra endurance events where a lot of it is in zone 2, right? I imagine. And then you've got interspersed with your HIIT. You need to do HIIT with that. Those two will help you develop and potentially increase or stop the decline of your VO2 max. There are therapies that can help as well. So a new therapy we introduced at the clinic for the last 6 months is something called reoxy therapy.
I've done it. It's very good.
Yeah. And so that's taking your body through cycles of low oxygenation, dropping your saturations down to about 80%, which is unusual, very difficult to simulate that, and letting your body have some adaptive responses to be able to survive in low oxygen states.
So smart stress, basically.
Yeah. It's a positive adaptation that your body then biologically has, which is I'm going to be able to draw my energy sources of the substrate that I use alongside oxygen better, which is coming carbs and fat, utilize them best so you become more metabolically flexible. Yeah. And also I'm going to improve the plumbing and the pump to deliver oxygen around the body. So your heart pumps better, and your respiratory system, your lungs expand more, and your plumbing becomes more elastic. So the pipes become more elastic. And all of that leads to improving oxygen delivery, number one, and then drawing on the substrate better. So in combination leads to better VO2 max. And so we're seeing great results. So that people feel that they can do their exercises longer. If they're more elderly and they struggle going upstairs, they can climb stairs better. If they're younger and they're doing endurance events, they can do their endurance events better. If they're the athletes I work with, they can go into the championship rounds with less fatigue, right? And energy is required for everything from thinking to digestion to movement. Everything requires energy. And so your VO2 max is really important.
We've talked a lot about oxygen and the importance of it.
Absolutely.
I think people will want to understand why the fuck we go and sit in the hyperbaric chamber. I think people kind of just...
And what is it?
What is it? And I think from my perspective, the bit that I've felt the benefits, but I've also always questioned really my full understanding of the process and the benefits of it, because from my understanding, obviously our blood oxygen saturation is naturally sat at 95 to 99%. Yeah. And so flooding the body with more oxygen, does it need it?
Good question.
What are we doing? What are some of the benefits, and what is the hyperbaric chamber?
Yeah, so we use oxygen in the clinic in 3 ways. So one is cycles of low oxygen, what I talked to you about, the reoxy or intermittent hypoxic training. The second is high pressure oxygen therapy, which is hyperbaric oxygen therapy. And the third is O3 or ozone therapy, systemic ozone therapy. With the high pressure oxygen therapy, what that does is that we normally carry oxygen on our red cells within our blood, okay? And there's 4 carrying sites on the red cell on our hemoglobin. So what we're measuring in the oxygen saturation probe is how much of our red cells are saturated with oxygen. And it's usually 97, 98, 99%. And when we do high pressure oxygen therapy, the oxygen particles become smaller under pressure. We start to carry oxygen not just in the red cells, but also in the liquid that carries the red cells, the plasma. So the reservoir of oxygen carrying capacity doesn't increase by 0.5, 1, 2, or 3%. it increases at 2.2 atmospheric pressure by 20x. Yeah, 20 times what you can normally carry. Now, what does that lead to? That then has end stream effects of better cellular function, antioxidant benefits, and then we think hyperbaric is mostly from the oxygen. It's not. It's actually from the pressure effect. The pressure effect being the body being under pressure causes an adaptive response. What is that adaptive response? A stimulation of our bone marrow to release stem cells and growth factors. Those stem cells and growth factors then go on to stimulate regeneration and healing, creating new blood supply to our organs, stopping our organ shrinking. So for those reasons, it's brilliant. And then we prescribe that to patients for for performance. It can be used for performance in combination with different treatments, can be used for healing, and can be used for longevity. So the longevity benefits are that if you do a certain number of sessions a year, there's clinical studies to show that your DNA length improves, which is another biological age test, by the way, which has not gone out of fashion now, but your telomere length improves. We use it in combination with something called epitalon, which is a peptide that also stimulates telomere lengthening. And telomere lengthening is really important because cell replication happens all the time in the body. So we want healthy cells to replicate, right? And if we go back to why intermittent fasting has become so popular, it was based off a Nobel Prize that was given where they established that intermittent fasting stimulates autophagy, our aging cells to die and be removed, okay, which creates space for new cells, okay? So stem cell production is really, really important for regeneration, for continuing to sustain life in the longer run. And then you've got oxygen for the energy perspective within that as well. So that's hyperbaric. And that was the first investment I made when I was making that clinic. I was like, okay, I believed in the power of activating stem cell production because I worked in stem cells in 2007 and I saw it in action. And then we started to apply it to people before they had disease based on the fact that we all stopped producing as many stem cells as part of one of the key hallmarks of aging. And just seeing how that can help people has been brilliant, transformative.
For argument's sake, let's say you take someone today, let's just say a runner, for example.
Yes.
And we've optimized the baseline, right? They've got everything in pretty much dialed in. The blood markers are good. We're operating from a pretty healthy starting point.
Yeah.
How would you look to rev the engine for that person to improve performance? And is performance something that can still be improved as we age? Let's say, because I think a lot of people, like traditionally 10 years ago, say, well, I'm 35 now, or I'm 40 now, or 45. I can't still perform how I could. And we're seeing that debunked. You look at Cristiano Ronaldo, you look at Lewis Hamilton, you look at these athletes that are aging but still performing.
And the next one will be Mo Salah. I predict that because he's the self-health that he does and the self-care that he does is remarkable, right?
So what does he do, and what would you do with an athlete like that who's maybe starting to get a little bit older to help them to still boost their performance? Is it possible to still boost performance?
So let's talk about things outside of the WADA regulation. So there's professional athletes and there's kind of, let's just say, semi-competitive athletes. So we'll start with the semi-competitive athletes.
So we're talking about the stuff that's legal and available. Legal outside of like testing.
Yeah,
right? Yeah,
and,
sure.
And legal outside of WADA, which is the World Anti-Doping Organization Association.
The good stuff.
The good stuff.
The good stuff.
The good stuff, yeah. And the stuff that we need it. If we want to be performing like we did at 25, biologically you need it because there is a delta that started to happen. We start aging at 25 to 28. So things start to slow down. So then you've got to start thinking, what things do I slow down and how do I support them? So I'd start with digestive health, making sure that you're absorbing the nutrients that you're putting into your body. You're not driving inflammation through that. It's just such a basic thing that is often overlooked. For example, whey protein. Have you got a case in, I see it so often, dairy intolerance, driving inflammation. You're not absorbing all that protein that you're having is a simple example. So that's one. Digestion, mitochondria, support your mitochondria. They need health. They need a lot of help if you're looking to get them to behave like they did 10 years ago. Stem cell production, things that you can support stem cell production, brilliant. Do them, especially as you get older, you'll find them beneficial. Growth hormone production, this is why things like the peptides for growth hormone support and recovery all really help as well. And depending on, this is personalized, depending on person to person, your ability to draw on a substrate of fat as an energy source and be metabolically flexible. So things like ice bathing, cryotherapy, as well as peptides like MOTC, we're using that with great results. When you start to look at, the different components and you break it down and say, okay, those are the components that produce performance for this specific type of athletic thing, and you personalize it depending on the sports, because every sport's different. You start to see your patients say, yeah, I feel like I'm performing like I did 5 years ago and 7 years ago. And then you're like, okay, that's what you're looking for. So that's the science broken down of it. Yeah. And then within professional sports is bound by equality, right? WADA, the whole purpose of WADA is to say like it's all about equality and access. And so peptides weren't banned, they're now banned. But things like hyperbaric oxygen, therapies that restrict your amount of oxygen, reoxy, and nutrients, good supplementation, gut healing, reducing inflammation, and other forms of support are all possible. Yeah.
I want to touch quickly on hormonal health.
Yeah.
I think it's a big area at the moment. In respect of men, obviously testosterone, we hear a lot about, especially as men age. Can you speak briefly to male hormonal health, female hormonal health, the challenges and the solutions that we have to improve that? Because in recent times, we see a lot about it, right? Men struggling with low testosterone, women with dysregulated hormones. It's a real issue.
The biggest issue is the fact that we're looking at these end markers of hormones. So we know about testosterone, we know about estrogen, and we know about progesterone.
Well, you can use me as a case study in this, right?
Sure,
I came to you, testosterone markers were in range, but my DHEA was low. So maybe as an example.
Absolutely, yeah. So when you look at hormones, it's about looking at the orchestra of hormones. And the orchestra of hormones has different parts of it. You got the tube, the trumpets and the tube section. You got the piano section. You got this, and they all collectively make a beautiful sound that produces health. So, what are the key important hormonal systems? Thyroid. Looking at autoantibodies of thyroid. Thyroid is like your energy currency of your cell. Adrenals. So that's your stress reservoir. Okay, that's produces your DHEA and your cortisol. But your DHEA is a precursor for your testosterone and your other female hormones. And then you go into recycling, right at the end. And involved in recycling is methylation and also liver health and some nutrients involved in that. So that tends to be the important ones we look at. Growth hormone sits outside of that. You can also look at growth hormone as well with markers like IGF-1. Other important ones is your blood sugar response, depending on insulin, glucagon, etc. But we're going to exclude that for the sake of this conversation. So when we approach hormones, we look at all of those in your foundational panel, just to get an insight of what that orchestra is doing, producing, but also recycling. Because if you're not recycling well, you're going to have increased risk of breast cancer, endometriosis, fibroids, polycystic ovaries, gynecomastia for men, right? And high estrogen for men as well. So understanding that it's not just about giving you TRT, right? And it's not just about giving you HRT, which is hormone replacement in terms for women, estrogen, progesterone, and a bit of testosterone. It's about looking at the whole orchestra. And then off the basis of that orchestra, then say, okay, actually for you, we're going to focus on your adrenal support because we know it's a precursor and it's going to drop down into testosterone. If I give you testosterone now, likelihood is that you need to be on it forever. You're too young for that, right? With medicalizing you. Whereas how can we improve the root cause of it here?
Do you see that a lot?
Yeah, a lot. A lot of adrenal dysregulation and a lot of detox issues. Those are two, because we're overwhelmed with toxins, right? So we need to be supporting detoxification. And this is where like integrative approach is much better, where you can utilize supplements, nutrition strategies, go put someone on a 2-week detox plan. And then a lot after that, you'll see their hormones get a bit better. Try someone on a bit of supplement support for their adrenals. If someone's got antibodies in the thyroid is dropping, work on them on the inflammation perspective, usually driven from the gut. bring down the inflammation. The thyroid improves. The other hormones also start to behave better as well. So we're reductionist by nature as doctors, and because we're drug based, we reduce it down to one thing. We give them a drug for that one thing, but it's not helping someone with the orchestra perspective. You may sharpen up the trumpet section, and it will drown out the rest of the noise. So your beautiful sound will be just a big trumpet playing.
Couple of final questions as we start to wrap things up, because I feel like we could be here for hours. Social media and the wellness world likes to tout lots of different therapies and solutions and supplements. What are some things that you see either through clients coming into you or just out in the world that's very popular or very talked about or very trendy right now that you think actually don't really work?
I'm not convinced on mushrooms for disease.
Specific kinds?
For disease.
For disease
Modification. I think as a doctor, I think of people that are healthy and wellness, and then people that are sick and that have disease or pre-disease. And I find that not all mushrooms, I think they provide a baseline support, things like shilajit and lion's mane and things like that, but you cannot rely on them for modifying and moving the needle with disease. I've just not seen it work well. Okay. So they can be a nice add-on, but I think there is a risk that they could be, when you hear supplements being, or anything being said, okay, this has anti-cancer benefits. Someone with cancer might rely on it to treat their cancer. And that's a risk, right? And we don't have cancer, so we're not thinking about that. If someone, etc. So that's an example. I think we just, and there's probably a lot of examples. Mushrooms, the first thing that came to mind. I just think that if you are in a health state that is debilitating you, whether it's classified as a disease or not classified as a disease, then you should seek expert guidance to help you get out of that state. But if you're not, and you're looking at these, you can try these wellness things and see how you respond to it. And you probably will get some response to it because your systems aren't that massively dysregulated. I think that it really depends on your starting point as someone. If you as a way to engage with the content that's coming out there, that's often associated with some products. And the dangerous part of this kind of pre-disease world or peri-disease world is that it's unregulated. And what does that mean? That means that the providers providing knowledge out there, their claims are unsubstantiated and there's not enough evidence base to support them for disease. So fine for wellness, but if you've got a peri-disease, you got a strong family risk of cancer or strong heart disease in the family, and you want to modify that, just go to experts that can help you, because you can't guarantee that with these some of these wellness claims. Yeah, absolutely.
Final thing that I've been holding on to that I wanted to talk about with both of you. Brian Johnson, sort of a poster boy now for longevity, and I suppose this more, what feels to me at least, kind of elitist, very high-end, niche, extreme form of supplementation and therapies and tech. It's a broad question, but what's your take on what he's doing?
And there's so much to that. I think you two are more poster boys for longevity. So what do I mean by that?
We'll take that. That was on camera.
That's the clip. We got that right.
Because longevity is about quality of life, right? Now, often most people come to me and say, look, I've seen Brian Johnson and he's just not living a good quality of life. In terms of just constantly being on therapies and trialing and experimenting. I'm not going to go into what I think, whether I think there's a commercial aspect to what he's doing. But undoubtedly there is, right? And but I think for me it's net positive, because he's brought attention to a philosophy. So I think net positive. He's brought attention to the space of the philosophy, the idea that you can be scientific to live longer, and you can apply a scientific methodology to yourself. doing so.
Yeah.
Not everyone has the same blueprint though. Everyone's blueprint is different because everyone ages epigenetically slightly different, and their allostatic or environmental load on them is different with different biological effects, right? So everyone's blueprint is same, but actually different. And that's how we practice medicine. So if you're looking, like you go to a lawyer for legal advice, if you're looking to get your blueprint, you go to the experts that know this science and medicine, and then can create that personalized blueprint for you based off data. But I think net positive, particularly in the UK, because UK's attitude has been so conservative for long-term health, right?
I would say on that prior to, I started working with Dr. E probably five or 6 years ago. We first started working together. If you'd have asked me at that time, how would I rate my individual personal health? I would say high energy, I sleep great, I train well, I recover well, I felt great. If you'd have told me at that time there's 20% more in there, I'd have said, no way, it's not possible. My wish is for everyone to realize their potential, their human potential, because I didn't know at that point that I had another 20%, that I could feel that much better, that despite now being 5 years older, I could feel as good as I feel now. And that's come from going through this program, these interventions, and it's a prioritization of my own health and well-being versus the things that I was previously spending money on, which were not important and not aiding my health. Health is foundational. Our enjoyment of life, how we show up in the world, how we can be of value and service to our friends, our family, our communities, is so rooted in how we feel physically, emotionally, spiritually, which is ultimately the physical form, the vessel that carries us. And it's such an important investment. It's the most important investment we can ever make. So thanking you for going through this process, because I didn't know it's possible to feel this good. And the impact it's had on my life and those around me is I can't really put into words as much as I've done a okay job at it just now.
Can't put it into words other than that lovely close. And I think within that is a really important point to close on as well, which is that it's health and longevity as a facilitation of a fulfilling and interesting life rather than as an end in of itself.
Yes.
Which is where I think the critique of Brian Johnson comes in, right? It's like he's doing it to do it, but is he happy? And maybe he is, and he actually seems to be living for him a quality of life that he enjoys, but it's not going to work for everyone. And so it's about, again, that personalized, unique, individual approach of like, why do you want to be healthy? Why do you want more energy? Why do you want better sleep? You know, because I want to feel better. Why?
Yeah.
So you can play with your kids into your 40s and 50s, whatever the reason is for you, so you can carry on training, so you can enjoy your life. And I think that's the most important piece.
I really would hope that this end of healthcare stops being a luxury good. I really, really hope that everyone can access this type of philosophy and understand that by engaging with your health in this way, you come out of your head into your body. And it's not, as you correctly said, it's health, spiritual, physical, emotional. All of those things we encompass that all together, because your quality of life, your relationships, everything, your outlook, your potential, your motivation, everything changes, and your ripples turn to waves, like you said. And that, you know, my work is done. You know, if I could change support that one person to develop that and become a ripple for others in your family, friends, network, to then start to deploy some things that change their quality of life, I'm happy. I can retire.
Not yet.
Yeah, the banks won't let me.
We've got work to do.
But you know what I mean.
I know what you mean.
It makes me happy, and But yeah, I just hope we can collectively, and as we're doing, as you guys are doing, we can collectively continue to inspire others, and take wellness for such a long time. It's been a luxury good, right?
Yeah.
With these wellness centers around Europe, and people go spend lots of money to go there, but we got to try and democratize this this understanding, and as we're all doing.
Yeah.
Keep at it, boys.
Amen.
Amen.
Thank you,
I think perfect place to
enjoyed
close.
that.
Yeah, thank you so much, Dr. E, for joining us. I'm sure people learnt a lot. I certainly did.
Me too.
we'll share everything in the show notes of how people can connect with you and your work and the work at HUM2N. And hopefully we'll bump into lots of people at the clinic as a byproduct of this conversation. So thank you.
Absolute pleasure. Thank you.
See you next time, everybody.